Hi everybody, my name is Dr. Thomas and I'm going to be talking today about the foot and how we can help those with foot pain by prescribing custom fitted prescription orthotics. The foot is pretty complicated. It supports your weight 24/7. You have actually three arches in the foot. You have the medial arch that everyone is aware of, the transverse arch, which is right here below the toes, and you have the lateral arch right through here. All three arches are supposed to support your foot. If any one of these arches starts to collapse, there can be a problem. What happens when these arches start to collapse is the bones themselves will fall with it, creating a flat-footed presentation. This is an example of a flat foot presentation. And as you can see, it's pretty nasty. This orientation change of the bones of the foot creates a number of cascading events that take place in the leg and the hip and even the shoulder. In this demonstration, you can see with the normal foot that we have a nice healthy muscle. All of the 26 bones in the foot are oriented properly. A nice medial arch through here, a nice transverse arch through here in the toe box region, and a lateral arch on the lateral side of the foot through here. All 26 bones should be situated in such a way so as to support the entire frame of the body 24 hours a day, 7 days a week, 365 days a year. However, if any one of these bones starts to collapse, it can cause a lot of pain here in the medial arch region, and it literally will crush the muscle here and create a lot of atrophy to that muscle, such as in this example here. Note how this muscle here is suffering from these bones here. I'm going to put up both of them so we can compare the two, and you can see that there's a considerable difference in the body of the muscle and the suppleness of that muscle. It just looks very unhealthy, and it's very painful. Now, whenever you have a drop in the arch of the foot, it creates an orientation problem in the fibula and tibia of the lower leg here and the femur, where both of these areas will internally rotate, creating a problem in the pelvis, where the pelvis now will drop down on that rotated side and create a high hip on the opposite side. That can be very problematic and can cause lower back problems, hip pain, and knee pain. Whenever you have a torquing here in the lower part of the leg and the upper part of the leg, that creates a lot of instability issues in the knee joint and can cause pain to occur in the knee over a period of time. This represents the model of your pelvis. On both sides of the structure in the center, you have the ilium, and the structure in the center is called the sacrum, and it is at the very end adorned by a tailbone or coccyx. Unfortunately, not everyone has screws in their pelvis to give you that extra support. Anyway, this x-ray shows how not having orthotics can create an imbalance if you don't have feet that support you well. If you lose an arch, you end up with rotation in that pelvis, as we talked about earlier in the other diagram. This causes wear and tear, and the body ends up having to lay down extra calcium deposits in the areas of the joints of the sacrum through here and the ilium right through here on both sides. That it can be very painful, and it can be avoided with just simple orthotics. We do foot scans, and the foot scan is what's necessary to help us to determine whether or not you need an orthotic.
Do you need orthotics? You may need orthotics if you're suffering with plantar fasciitis, heel spurs, bunions or excessive corns, flat feet, heel pain, knee pain, hip or back pain, If you're suffering, custom-fitted orthotics may be just what the doctor ordered. Contact Dr. John Thomas for more information today. Call 770-460-1911 for your free state-of-the-art digital foot scan. Visit Dr. Thomas at www.proven-back-pain-relief.com. That's www.provenbackpainrelief.com.